to Health Aware's Heart Health series for the month of February 2021. It is hard to believe that we are on our last session here today. We're going to be talking about one of my absolutely favorite topics in regards to taking care of our hearts, and it is integrative medicine. I always like to share with everyone. My name is Shannon, by the way. I'm one of the instructors with our wellness center. I have been in nursing and cardiology and wellness for the past 30 years, with the past 5 years specifically cued into integrative health. So integrative health being our focus today when we talk about health for our heart. I'm so excited to talk about this class. It was so much fun to prep. Always happy and honored to share this with you. So if you're joining us for the very first time, feel free to go back and watch the last 3 series from each Monday of this month. But also, if you're just joining for today's class, that's wonderful because it's truly foundational to helping prevent a lot of the things we've talked about the past few weeks. And it's the goodness and the hope of everything in medicine that we look for nowadays. Couple of things to remember. When we talk about integrative medicine, we are coming from the perspective of being complementary to anything in Western medicine and all the advances of Western medicine. I often think there's confusion for many of us because we haven't grown up or been exposed to certain things in our Western culture about basics of health and medicine that will prevent us from really usually having to go to the doctor too early in life for any type of major interventions, but instead it's more of a preventative approach that most of us want to take. It's not always so much about our quantity of life, but our quality of life, and integrative medicine really helps with that. So what is integrative medicine, and why is it becoming such a kind of sought after desire for all of us as patients? Functional medicine, you'll hear kind of the two terms come together. It's because there's this fusion that we're needing to have now of all the advances of Western medicine, all the incredible healing that's done through the science of Western medicine, complemented with a lot of Eastern medicine and also just healing modalities, both Western and Eastern coming together. Now, this becomes really important cardiology-wise, which is what we're about this month with our heart health. It's important because it's kind of the basis or foundation of a lot of the rest of the body systems. So cardiology is perfectly suited for integrative medicine and its approach because 80% of coronary artery disease, which is the #1 killer for both males and females, we've talked a lot about that in the last few classes, 80% of that is not only preventable, but it actually, I like to use the term, it's actually, it preserves you for a much longer time. It allows for a positivity of your lifespan to actually live your life and it be more functional and healthier without, of course, the 20% that we have of genetics and gender and age. You're able to actually come into a place of you being in control. So lots of different notes here. Medicine in regards to our Western medicine, most important, anything you ever approach regarding your physical health, you always want to seek out your primary care physician. Have a primary care physician who can then lead you in the correct path of where you need to take. You also need to have everything, ideally a prescription for you that is unique and special just to you. And that's where integrative approach comes in. Part of the situations that you get concerned about, especially as you enter into any type of physical injuries, it can even be when you're really young, as like a teenager, or as you do progress into life, is how do I fuse the best of everything that there is out there in Western medicine with things I'm in control of too. So integrative medicine is the approach of taking all the wisdom of Western medicine and bringing it together with things that we know we can do and we can help control within our own health. So one of the most important things I like to always talk about is a holistic approach in regards to you and your health. Over all these different, 30 plus years of medicine, I was guided by many different professionals, healthcare professionals, that the healthiest of them were the ones that took everything they knew in Western medicine and all of its advances in technology, but they started with a foundation of the basics. And integrative health is that fusion of the two, bringing those together. The most important part is collaboration. You're a team member with your physician and also your nurse practitioner, your physical therapist, your occupational therapist. Oftentimes, if you've been in the hospital setting or you've had surgery, you've had injuries, there's this approach that we take as a multidisciplinary team. So important. But that's kind of in more of an acute setting. So what do we do for our heart health when it's not necessarily an acute setting, like we talked about, recognizing the seriousness of a heart attack? This is more the day-to-day living lifestyle things that oftentimes will keep you from having a heart attack. It's preventative. So this fusion of the two is very important. So at the hospital, Community Memorial Health Systems, we have recently, the past 2 years, started up our Fitness and Wellness Center to bring in more of the modalities of integrative health. These are things you can use on a day-to-day basis. It is not to ever replace what your primary care physician can prescribe for you, but oftentimes it will be those things to bring better health for you holistically overall. And when we say holistically, whole system, whole body system, mind, body, heart, spirit, all of you. You need to look at it with integrative medicine is the approach is you collaborating with the partners in your team, all those different people and your instructors in any way. I know certainly with Health Aware, we can always get you started. You can contact and schedule a consultation with Andrea Ricketts, our nurse practitioner, and she can plan out something for you that gets you into some of these modalities we're going to talk about today. So one of the leading physicians out there in the world right now for cardiology and interventional cardiology, and I have like my Bible I kind of live by here with interventional cardiology, is Dr. Mark Houston. You can Google him and kind of read up some of his qualifications and some of the things that he believes in. And one of the things he brings up about those of us having heart conditions is that he heard one too many patients come to him over time and say, I feel like the situation is too impersonal. A cardiologist sees me for the very first time in the emergency room, or they see me because they've been referred by my primary care doctor, and everything is kind of just my disease versus who I am as a person. So he kind of started taking a different approach. We follow a lot of Dr. Dean Ornish, and we started learning what are basic things we can do to kind of avoid those scary acute heart health situations and meeting a cardiologist in these impersonal situations to having it be more of a functional relationship. It's a relationship between your healthcare provider and yourself. One of the things we talk about is an emphasis on certain modalities for integrative health. Number one, nutrition. Nutrition, we say nutrition, we mean diet. A lot of people like to use that word. I know it's becoming kind of a negative to use the term diet because it makes some people think of deprivation. So it's just where your brain will go. But for any of you seeking treatment, you can see our registered dietitian, Melissa Davidson, at Health Aware. She can do personalized suggestions for you in regards to classes to take. She offers everything from a heart healthy course to carbohydrate classes, metabolic syndrome classes, plant-based cooking classes that she offers. So much out there to you through Health Aware. Getting a prescription from your doctor. Go to your doctor and say, hey, I want to see a registered dietitian. Most people have at least 1 or 2 visits that are covered by their insurance. They don't even know that's covered. Do these things that don't require kind of this physical intervention or pharmacological intervention, meaning we're going to give you a pill, right? That's a lot of what I saw over the years with, hey, I'm going to throw you a pill at you and at your disease, but I'm not going to treat the root cause of what's actually causing you to take the pill. So that's really important to remember. Dr. Mark Hyman and Dr. Mark Houston, lots of Marks there, are two of the leading physicians that will tell you you need to start thinking about getting your medicine from the farm before the pharmacist. Start there. So very important. Start with nutrition and diet. One of the other things we talk about in regards to our heart health and remembering that the two go together, they're like Jack and Jill, Hansel and Gretel. If you are having issues with your heart, you can almost guarantee for many of us that we have underlying metabolic syndrome going on. Metabolic syndrome meaning we're pre-diabetic, possibly. Blood sugars are running out of control, or they're running too high. All kinds of different things happening with the body that is usually directly tied to our nutrition. And the second part of that is being maybe already diabetic, type 1 or type 2, which any of those is going to lead hand in hand, again, Jack and Jill, Hansel and Gretel, into heart problems. So seeking nutritional help is key. In regards to other modalities, I'm going to run through a list of them. We offer every single one of them at Health Aware. Go through the website, you can sign up for a consultation, see our nurse practitioner, and she can guide you there about where to go. Also, if you want, you can go to your primary care physician, have them write you literally a prescription for integrative intervention. And many insurance providers out there will actually cover some of these modalities, so kind of keeping those in mind. Number two, most important thing in modality you want to remember for helping our hearts is exercise. You are made to move. You are physically wired to benefit holistically from exercise. It could be something as simple as starting with a walking program 10 minutes a day. So I'm not going to take you through every little, personal training situation that you could have. The most important place to start is get a physical clearance from your physician. Have them tell you what is unique and tailored for you. You may have an injury. You may have recently had surgery. You may need a goal set for you. What is going on internally? Your physician will be able to do blood work. They'll be able to see where things stand for you on the inside of the body to tell you what maybe you need to move physically to help the body. And any exercise is going to benefit the heart, cardiovascular, right? Any aerobic activity. You get your heart rate up, your respirations, you get them up, you work the lungs, you get into any type of circulation out to the rest of the body, benefit all the way around. 20 minutes, 30 minutes a day is maintenance level for most of us. You want to start somewhere though. If you just take 10 minutes and go for a nice walk your dog, do a little gardening, clean your home, start moving physically, but see your physician first, get clearance on that, and then start maybe stepping that up. We oftentimes talk about you can see a personal trainer with the Fitness and Wellness Center. There's tons of experts out there in our area in Ventura County. The Studio of Ventura is one that is very highly qualified. Helia Glenn and her team. There's also multiple martial arts studios here in Ventura that offer high quality physical therapy training through their even dojo centers, any of our physical therapists, those sort of things. So they can start you somewhere with exercise. Something as simple as telling your doctor, I feel like I need just to gain some strength. And I don't know about you guys, but I feel like all of us through COVID, from kind of being stuck in our homes, if we haven't taken it to the extreme maybe of doing too much exercise, we all could benefit from some basic physical therapy. So one of the things to benefit your heart. The other thing, how do you maximize feeling better as a whole through exercise? What are the clinically proven things? So good medicine is only as good as the science behind it. Most of us have nerded out on that quite a bit and geeked out on it the past year with COVID. The things we look at is what has been proven clinically in clinical trials. The next one I would have to say is meditation. Meditation and breathwork. So Kate, our nurse that leads our meditation series, if you have not taken one of her courses online virtually, I can't recommend it enough. She has the gift of being able to tap into whatever your needs are to maybe mentally and mindfully get out of your physical body sometimes and just recognize and have an awareness of what's going on around you, maybe to escape what's going on around you, and then be able to calm the body through meditation, right? Part of the nervous system. Meditation is clinically proven to not only lower our blood pressure, right? So hypertension for our heart, very concerning. But it's also been shown to actually show changes physically in our brain. How we work through stress, one of the leading causes of coronary artery disease. Meditation is one of the things as a modality that we can use with integrative health that we have proven works. The other thing, breath work with meditation is so important, just connecting to your breath. Metabolically for your heart, it is essential to learn how to breathe well. One of my favorite stories with Dr. Andrew Weil, who is our leading integrative health practitioner in the nation for teaching all of the other physicians about integrative health, osteopathic pathways, especially for the body, is Dr. Andrew Weil. And he said he put a group of about 500 physicians together, and he asked them to come together and talk and decide if they could tell a patient who had heart problems the number one thing they could do to improve their health, what would it be? And they argued and they fussed, and he said they kind of carried on, went round and round, and they all came together and they decided that they would teach everyone how to breathe well. Metabolically, it has such an effect on the body, the mind, and the heart. So taking those meditation courses, taking 10 minutes a day to stop, catch your breath, focus on breathing, so important. Which brings us to yoga, my personal favorite. It is a combination, right? The word yoga. It is a word that means union or yoking of together. The beauty of yoga, especially in clinical trials, is that we are bringing three things together. Exercise, right? Moving the body. The yoga I teach, especially if you're taking our Saturday courses, we get a little bit more into a little increased activity, a little more cardiovascular training, increase your heart rate, increase your respirations. We want to help kind of light your fire. Exercise does that. Meditation, being mindful, stopping and focusing. And 3, breath work. Breath is everything, right? So we often talk about with yoga is the union of all of those things that come together to benefit the whole, so the whole body. You can take Heidi's classes, Megan's classes, my classes. Find what suits you. Everyone, again, unique. Go to your physician, find out what works. The other modalities that have become very, very popular, and we are finding the clinical trials behind them are actually pretty amazing, is our acupuncture and chiropractic therapy. Not just chiropractic therapy, but touch therapy, meaning your massage therapist, your Reiki therapist, your modalities of any type of touch therapy. Again, you go back to how you're wired as a whole person. There's this beautiful system within the nervous system that reacts appropriately, especially with the limbic system and emotion, that benefits the physical body. So knowing those things are out there, I'll give some references for who you can kind of look into for that. The other modalities is art and music therapy. I like to say this is probably one of the most untapped into resources we have for our nervous system. How do you feel mentally in listening to music that appeals to you? Think about if you see a beautiful painting or a picture, photography. Art and music have a way of tapping into parts of us that nothing else does. Not exercise, not breath work. I'm getting chills right now thinking about it and the connection to the body. Seeking those things out. We often offer clinics, or we did pre-COVID, and we will get back to it. The hope is on the horizon for that, of art therapy and music therapy. Your obviously optic nerve, being clued into what you see, the things that you hear, the senses, and they're all tied into that nervous system. Probably the one I would say is extremely important nowadays is aromatherapy. I bring that up because it's kind of come to the forefront in this pandemic we're living through with the COVID crisis. The situation of the neurological effects of losing your sense of smell, the olfactory nerve being so inflamed that it can't respond appropriately to any type of smell, or it doesn't smell at all. You will learn that you will smell something and it triggers memory, right? So the neurological tie into our limbic system, emotions, so important. truly has shown changes in the body, energy, heart rate, blood pressure. Right now, today, I was having a very squirrel day in my brain and monkey brain and couldn't seem to focus. Had a lot of allergies going on from the excessive wind we've had. And so I went ahead and I started through Young Living Oils and my friend Emily, who is a aromatherapist, eucalyptus oil. Kind of opened everything up, gave some clarity. The smell alone makes you think of nature. It kind of helped tremendously. It's diffusing through the room as I speak right now. The other one, nature, getting out in nature. This one is under really heavy-duty research and scrutiny right now in regards to how does the brain react when it is in nature. I just go back to basic biology. We're mammals. We're made to be in nature. We're supposed to be outside. We are not robotic. Okay, our brain does not work correctly if all we are doing is being on a screen. Okay, we actually have slowed psychomotor skills from being on a screen. You physically will change from too much time on screens. We've all suffered through it. It's something we're going to all be working through together. It makes heaviness on the heart because it creates stress from one, not moving enough, not getting enough exercise. It is actually at the same time mentally very intensive and draining. What corrects that? Get outside. You need the vitamin D from the sun, 10, 15 minutes every day. Go outside, look at trees, open your eyes out to the horizon. It is how you are physically made and wired. The body reacts appropriately to what is natural to it, and that is nature. Couple more things here. Mental health support, imperative. Cannot speak of it enough. Specifically, cognitive behavior therapy. So seeking out a mental health professional that your primary care physician would want you to go to if it were his family or her family. Someone that's there to tell you that you're not alone, that what you're going through is physiologically part of why your heart feels heavy. Maybe it's why you're hardening your heart, especially the past year. Your own unique situation is always open to the help of another person to come in and guide you. So mental health, right? Getting our minds right. And then the last part I want to talk about is the most important part, in my opinion, because it is the part clinically and scientifically that we are seeing the greatest advances in fusion of Western medicine and Eastern philosophies and practices, is spiritual health and healing. Dr. Dean Ornish, who is one of our leading cardiologists who went through his own health crisis with his heart and is the leading physician to show us a reversal of coronary artery disease for the heart, spoke of his own situation like this, and I want to quote him directly. I wrote it down. When the spiritual and emotional parts of your heart are open, the physical heart and its health follows. So the essence of everything that you are is not just the physical muscle of your heart, it's the spiritual side of who you are. The person that talks inside each little part of your brain. That is what you have to get to first. And integrative medicine and all of these modalities help guide you oftentimes to get to that spiritual part if it's been shut off. And if you've suffered injury, if you've been through heart health issues, probably the number one, I think it's 65% of all patients who've gone through a heart issue, and I can personally speak to that over the years as a cardiology nurse and through working through cardiology clinics and 10 years in the ICU and the coronary care unit prior to that, everyone will go through a situation of anxiety, depression, symptoms that are being created from the root cause of something. And that's where tapping into where you're at emotionally and spiritually is so important. And what are those ways we do that through healing modalities? It usually means speaking to yourself in a way that you need to ask, where am I at, and is there something greater than myself that I can go to right now? It can be through prayer. It's often found through meditation, again, quieting the mental mind. It can be found through religious groups. It can be found through support groups. There's all types of different modalities out there for getting you to kind of stop and focus in on your spiritual health. The heart has to be open to heal the rest of the body, and most importantly, of course, the heart. So what are ways we can do that? Oftentimes it's through walking movement. This has become a very, very popular clinical research tool where we tell you to go and walk in nature, and you can kind of start combining them. At the hospital here in Ventura, you can go onto the grounds and walk the labyrinth. I personally have found walking a labyrinth is one of the most calming and spiritual practices I've ever practiced. You learn to get out of your mind just by trying to follow patterns and a path. And we all need a path. Our heart needs a path. You think about all the different pathways of your arteries and your vessels and all the little capillaries and every little thing, they all have a path. And walking a labyrinth is truly probably one of the most calming, mentally rejuvenating, restorative things you can do. And we want to invite you, always feel free to come and walk that and be there by the water and the fountains and in nature. It's beautiful. You can also walk paths. Walking paths are another thing you can go to if you don't have a labyrinth nearby. I know here in Ventura, St. Paul's Church has a small one. You can also walk that. In seeking spiritual balance, the other modalities can bring you to that, but at the same time, you always need to start with where you're at uniquely to you. That's going to be starting with your physician and starting with these beautiful advances we have in Western medicine of reading the physical body to maybe see where we're lacking with the natural body and the heart and the mind and the spirit, and we want to fuse all those things together. Last thing, I hear many people ask the past 5 years, especially in medical practices, clinical situations, definitely the past year of COVID, personal friends and family. Where do I get these tools? Where do I find them? I want to reference you back to Health Aware. Okay, we can guide you and refer you. We can do some basic workups and screenings. Just give us a call. You can set up an appointment. You can go to your primary care physicians. I want to point out a couple of local integrative health physicians who are outstanding. Dr. Kathy Kim, who is an integrative and functional medicine physician, is probably one of the most up-to-date doctors I've encountered the past 30 years, who is approaching you as a patient holistically. Everything about you. Heart, mind, body, soul, all of it, and wanting to help you. The other one is Dr. Matthew Bloom, and you can find their information online. He was head of the rehabilitative program over at the rehab center at St. John's Dignity Health Medicine. I have personal experience with him because he helped my father, who had a massive stroke, work through a lot of the physical disabilities that came from a stroke. But beyond that, I want to speak to his character in regards to each person as an individual, each patient. He's a specialist in osteopathic medicine, which is this beautiful fusion more and more we see of everything we know in Western medicine and this holistic approach to the body and the person. Kind, understanding, patient, intelligent, wants to look at root causes of where you're having physical problems. And so if you are looking for a physician through your primary care doctor for integrative and functional medicine, those are two I highly recommend. Last thing, guard your heart. Guard your heart. And guarding your heart means going to these basics that will maybe keep you out of acute situations for your heart. Heart attack, stroke, hypertension, atrial fibrillation, arrhythmias. One of the leading things we're learning with atrial fibrillation is its effectiveness in treatment is not only influenced by the wonderful medications that are available out there, but is also influenced by these behavioral things we can do on our own. So guard your heart, take care of it, try to soften. As Dr. Fauci this morning, I just stood out to me as I was thinking about class, said, learn to practice grace and empathy. Be aware of what is going on around you, but stay focused on what task is at hand. Caring for your heart, nutrition, exercise, breath work, meditation, yoga. Maybe seek some of those outside treatments, massage therapy, acupuncture. Go for a really good walk in nature. Spend time with animals. These will be the things that help maintain that whole health of integrative medicine. I thank you so much for joining me in these classes the past 4 weeks. It has been a dream come true to lead you. Take care of yourselves. I hope I see you Saturday for our last session of Yoga Specific for Your Heart. The light in me honors the light in you.